We need to talk about fentanyl. Overdose deaths from the powerful opioid are on the rise across the nation. Just last month, the Drug Enforcement Administration sent a letter to federal, state, and local law enforcement warning that fentanyl is killing Americans at an unprecedented rate, and that already this year, numerous mass overdose events have resulted in dozens of overdoses and deaths. It's happening in all 50 states and here in the district. The DMV is not immune. Case in point, late last month, Virginia police reported the suspected overdose deaths of two teenagers, 14 and 15, from counterfeit Percocet pills laced with fentanyl. The two overdoses were separated by days and, other than the cause, don't appear to be connected. Since their deaths, police have taken 4 men into custody, along with a cache of guns and 5,000 of these fake pills. While the arrests and seizures don't appear to be connected to the deaths, they are a win for law enforcement. And who's to say how many lives have been saved now that all those pills are off the street? So congratulations to the officers involved. But of course, we should fear and expect that they'll be replaced. In response to this rise, law enforcement has initiated efforts to crack down on traffickers and dealers, plus a shift in how users are viewed, more so as victims of a disease than hardened criminals waiting to be dealt with. As such, Prince William County Commonwealth Attorney Amy Ashworth has begun calling for more preventative measures like mental health treatments to get a hold of the illness before it metastasizes.
I'd like to see us get out in front of it and start dedicating resources to treat not only substance abuse, but the underlying causes of the substance abuse.
Now, I've been hearing calls for understanding and preventative mental health treatments ever since this country developed an addiction to opioids, and I agree with them wholeheartedly. But I'd like to know, where was all this understanding when crack had a hold of DC and the rest of America back in the 80s? Let me remind those who don't remember. There wasn't any talk of understanding back then. No preemptive measures, no mental health concerns. What was the answer then? Lock them up for long periods of time. Mind you, we're talking about roughly the same exact situations. The only difference is that I can see now is the participants involved and the communities being impacted. I wish this thoughtfulness had been applied to the victims of the epidemic in the 80s. How many lives would have been saved? How many families would still be intact? And if understanding had been applied then, would there be an infrastructure in place now to help today's victims? We can wonder, but unfortunately, we'll never know.